Good afternoon. Good afternoon, Clubhouse. Today I am here with the EMS students. So, guys, tell us your names and what brings you to Magnolia Clubhouse today.
I'm David Martin. I'm here for the ride-along for Cleveland EMS. And, yeah.
I'm Austin Lawrence, also here from EMS. Really here just as an opportunity to engage with the community in Cleveland and meet people.
I'm Sarah Ford with Cleveland EMS. We're here to observe and get a look into the lives of people dealing with mental health issues and how they get involved in the community.
Okay, so this is a question for all of you. So you answer in any order you want. What do you think of the Clubhouse? Now that you've been here, what do you think?
It's different than I thought. It's got a very unique structure to it. Everybody is kind of doing their own thing, but also like together. It's like structured chaos, but it works. It works very well. It's a good thing because it's not like there's no real hierarchy. Everybody's even.
Okay.
Yeah, kind of jumping off that, I really liked how right at the beginning I kind of couldn't tell who was working here and who was a member here. Everyone just sort of blended together and meshed together really well. It seems like the system really works for everyone.
Yeah, I think so far it seems just there's a wealth of opportunities, it seems like, for people to be engaged, and I also like the range of individuals that are here. Both in age-wise and ability to maneuver around the clubhouse and participate in the different activities and opportunities.
Okay, so what would you say going forward? How would you use what you've learned today going forward in your career? Made you think on that one.
Just a little.
I think the biggest thing has been, seeing behind the scenes, so to speak, and remembering that all individuals are individuals at the end of the day, have likes, dislikes, things they enjoy doing, things they don't enjoy doing, and trying to remember that, especially on our side when we're engaging with people in the patient-provider setting, and trying to meet people at that human level of things that they like, things that they enjoy, how they're doing on that human level instead of, I'm in a crisis, kind of high aggressive situation.
Okay.
I like that how you put it. You definitely would put that way better than I would. But I was gonna say, like, kind of piggybacking off what he said. Like we would be on pretty much like their worst day, or what they seem like would be their worst day, and to know that they have this side of them, that they're more than capable of doing that. So hopefully you can try to get them back down.
Okay.
We got to hear from a couple of people specifically things that they'd had issues with EMS in the past, and things that they found helpful communication tools. So it helps give us some insight on things we can do and avoid doing to help them feel more comfortable in the future should we ever interact with them on a crisis level.
Okay. With that, my final question: do you guys have anything else that you would like to add about your day? Anything in particular? It doesn't have to be anything specific about your visit here this week. Anything that stuck with you, or that will stick with you? Anything that you learned that you didn't know before?
I did a lot of my time up here on the communications floor.
The best floor I know.
The best floor, yeah, of course. I was super impressed by the level of equipment you have, and how easy it seemed for people to get involved in it. We had a tour come through while I was up here, and everyone made sure to emphasize that you needed no training, no experience. You were just able to get involved, and you could probably get some really significant experience up here, even skills that could help you in like a professional setting, with some of this high level equipment. And it seems like a really good way to get involved and be a part of the community.
Okay.
I would say I was impressed and surprised at the extent of the international involvement with Clubhouse all around the world. It was really fascinating, the little video that's running out there of the clubhouses around the world and all the different countries, and seeing kind of this wonderful ideal concept being spread out to help individuals all over the world. And literally until this morning, I thought Magnolia Clubhouse was just an independent place in Cleveland. So that I think that was really cool to see.
Okay.
I agree with what he said. That was very interesting, especially like the whole international part. And they just keep adding, like there's more new ones coming out. Also how long it's been around too. I thought it was a relatively new like situation for all this, but it's been what was it, since like the 40s, and then like it really started taking off like in the 90s when they got the government funding.
No, that wasn't in the 90s.
It wasn't in the 90s?
That was the 60s.
It was the 60s.
Yes, this place has been here since 1961.
61, yeah. And even talking to some of the older members, like I talked to the I can't remember his name, but he's been here since '86, and you know, asking him about the changes of what's happening and how it's growing from their perspective, and asking the new members on how they like it, and everybody, I haven't gotten one negative review on it.
Okay.
I think it also plays a really important role in the community. A lot of mental health funding these days seems to be going towards acute crisis management, with like hotlines and hospital programs, but I don't see a lot of funding and development in the section of sort of mid-level mental health management. There seems to be a lot of like just straight up therapy appointments or hospitalization. And this, I think, fills a really important mid-level position for people that maybe need a little more help on a day-to-day basis than just, you know, going to a therapy appointment once every 2 weeks, but a little less acute than, you know, an inpatient stay. And this is a really important role that Magnolia House is filling.
Okay. So I have one final question. Got any cheese? No, he knows what I'm talking about.
I appreciate. Yeah, this morning working in the kitchen was a lot of fun, helping make the lunch, and Ronald, you made me laugh pretty much all afternoon. So,
all right, guys, thank you so much for coming. I'm Ron. I am here with
David,
Austin,
Sarah.
Have a great day.